On Talking with Dr. Donna, we focus on 4 pillars of health to help build a generational health network to end the cycle of premature death in the Black community. I created Talking with Dr. Donna as a way to educate as many people as possible and give accurate information from a trusted physician. Go to Talking with Dr. Donna and get accurate information. And then share that information with your family and friends. And if you like what you see, like my channel and subscribe. Remember, every Thursday, keep your appointment with Dr. Donna. Welcome to another episode of Talking with Dr. Donna. As you know, you have an appointment with the doctor every Thursday at 6:30 p.m. Pacific Standard Time. If you are joining for the very first time, thank you and welcome. Please, if there's anything that you hear at the end of this episode that you learned something that you're going to share with a friend or a family member as an appreciation and a thank you, I'd really appreciate it if you go over to YouTube, if you're not watching on YouTube, to go to my YouTube channel, subscribe, and hit that bell icon. That way you get notified every single time we go live. Our mission here on Talking with Dr. Donna is to build a generational health network. By focusing on 4 pillars of health, we hope to end the cycle of premature death in the Black community here in America and across the diaspora. Our 4 pillars are emotional and mental health, spiritual health, physical health, and environmental health. All 4 of those pillars are extremely important to give us a global, holistic view of our health. So as you're thinking about why should I watch Talking with Dr. Donna, why should I be engaged and involved with Talking with Dr. Donna, it's because we are focusing in on you and our community. So please make sure to tune in and keep your appointment every Thursday at 6:30 p.m. Tonight, we have a great episode. We're talking about cervical cancer. And my guest tonight is Dr. Joy Cooper. Dr. Cooper has not only a medical doctorate degree, but a master's in science degree. She's a Philadelphia native and is a board certified obstetric and gynecologist here in the Bay Area. She completed residency at the Hospital of University of Pennsylvania and then received her MD from Howard University and got a Master's of Science in sexually transmitted infections and HIV from the University College of London and earned an AB in African and African American Studies at Harvard College. When she's not catching babies at work, she is raising her own baby girl, and she's filling her mission to impact women of the African diaspora through her telehealth startup called Culture Care. We're going to learn all about that tonight. Join me, Talking with Dr. Donna, in welcoming Dr. Joy Cooper. Dr. Cooper, thank you so much for joining us with Talking with Dr. Donna. Welcome.
Hi, thanks for having me.
Of course. So my first question is, January is National Cervical Health Awareness Month. What is cervical health?
Good question. I'll start quickly with what the cervix is. So the best way to describe the cervix is the window or the door into the uterus. So essentially it's the gateway to the rest of your reproductive health in terms of your uterus, your fallopian tubes, your ovaries. And so your cervix can act like as a door to block bad things out, but also is the way to, it changes throughout your menstrual cycle to allow sperm in if you want to get pregnant, and makes it so that sperm can't get in during certain times of the month as well. In terms of cervical health, really it's about maintaining that door. You want to make sure that there's no bad things getting in. So things that can creep in and essentially ascend to other parts of the reproductive system are things like sexually transmitted infections. And then sometimes you can have things like bacteria that just live in your vagina naturally that can climb up and cause issues. The biggest thing that we're always scared about is human papillomavirus, which we know is the reason and the actual cause of cervical cancer. And so a lot of maintaining your cervical health these days we know is kind of keeping that HPV at bay. And so, really, the best way now in 2022 is through the vaccine because we know that HPV is the common cold of sex. So, if you're having sex, you are going to be exposed to HPV and it's through skin to skin transfer. So, condoms are not going to protect you. So, really, it's about choosing your partners wisely as well as just again being judicious about what you put down there. So no crazy dishing and things like that. Like it is a self clean. Your vagina is a self cleaning oven, and your cervix lives there. So just treat it as such.
Cool. Well, I'm so glad that you mentioned HPV or human papilloma virus as the primary cause for cervical cancer. So a couple of questions. One, there's a vaccine, and do you recommend that vaccine for boys and girls or just girls?
Boys and girls. So as we know from ages 9 to 26 is when the guidelines allow you to vaccinate both. The problem is that, most girls are getting it from other boys or women are getting it from men and men aren't protected. So if you're only protecting the half of the population who can get cancer more likely, then you're potentially just continuing the spread of HPV. And since it is so common, we want to prevent that spread. So I've always been an advocate for, um, really, if we could put it in schools like most other vaccines, but because it's protecting against the STD, there's lots of controversy in America. But if you look at countries like Australia and even countries in Africa like Rwanda, they've rolled out programs that have really helped diminish the amount of abnormal pap smears as well as cervical cancer in their populations.
Great. So that's for all you guys watching. If you take your child to your pediatric office visit and they might say, hey, we have this vaccine, HPV, and you're like, why does my son need HPV? Dr. Cooper just explained why it's important for your son as well as your daughter to get that HPV vaccine. Let's talk also about, and when we talk about cervical health, the pap smear. And there's a
Mhm.
lot of confusion about when you're supposed to get a pap smear. Are pap smears still needed or still necessary? So can you talk a little bit about when we should be getting pap smears and really what is a pap smear telling you as the physician?
Okay, so first I'll start with what a pap smear is. So essentially, a pap smear is just exfoliating off a little bit of cells from your cervix. So what that does is give, there's a machine that can do it now, or a pathologist can look at it under the microscope and see are there any abnormal cells. And so they grade that abnormality from low grade to high grade, or just we don't know what it is essentially, and we need to do more investigation and that would be a colposcopy, which I can get into later. So that pap smear for 20 to 21 to 30-year-olds is when we would do the pap smear with just the cells. After once you turn 30, then you definitely always co-test, which means you're testing for HPV and abnormal cells. And so a lot of the controversy around, the changing of guidelines about how often we do pap smears is because we have HPV now. So before, the pap smear came out in the 50s and totally changed how many people were dying from cervical cancer. But, we were doing a lot of procedures that may have been unnecessary to, essentially get the low rates of cervical cancer that we did get. So really, I tell patients when you know better, you do better. And since we know that HPV is what causes cervical cancer and we know the natural history of cervical cancer, which is usually 7 to 10 years, we don't typically start pap smears until 21. So back in my day, and I'm not even that old, but I had to start a pap smear at 18, which was a
Yes,
very like mortifying experience. And it took me a
yes.
long time to go back and do that again because I was like, what is this? Um just was not a good experience. But really we start at 21 now, and really it's every 3 years in that range from 21 to 29. Once you hit 30, actually we do every 5 years. And so when I talk to Black patients, everyone talks, Black women, when it comes to health disparity, it doesn't matter what disease or what infection it is, we are always overwhelmingly affected. And the problem with Black women, the reason why we catch our cervical cancer late or we have higher rates of cervical cancer is because we aren't either getting pap smears at all or we're not following up. And so I have some really poignant memories from residency of a patient getting cervical cancer because she kept coming back to get another pap smear, but not getting the next step, which is a colposcopy. So
Hmm.
you can exfoliate off some cells like a pap smear, but it's not really like a lot of information. A colposcopy takes an actual biopsy or a little piece of tissue And it's a little bit more, and you're looking at the cervix under a microscope to see where the problem is. And that's how you figure out, does this person need to excise, this like abnormal tissue? Is it high grade where it needs to come off, or will it go back to normal over time? And so, really, the way that Black women are affected most is because we do not follow up. So the thing is, it's very scary when you get an abnormal result, but it's not time to, hide and just like wish it away. It is time to go through with the next step, collect the data, and know what your risk is for that progressing to cancer. And know that if you've been getting screened regularly, you most likely will not get cancer in the next 7 to 10 years. It's when you don't know what's going on that you really are at high risk.
Wow. Okay, that's great information, and I think it's so important that we talk about, our culture, right? Our race, and what it is that helps us stay healthy, and on the flip side, what it is that makes us at higher risk for certain diseases. Do you think overall that Black women are at a higher risk for cervical cancer?
I mean, essentially, when you talk about risk of cervical cancer, it really alludes to like risky behavior, shall we say. And so, you could extrapolate data from other STDs like chlamydia and HIV, where we do have higher rates of those infections than potentially. The hard part with cervical cancer is that HPV is so ubiquitous. It's everywhere. Like
Mhm.
everybody has it. So I think the hard part is it's hard to extrapolate there because everyone has, it's not like, most people don't have HPV. Um, I think again, the reason why the rates are higher is because of that follow-up. That's the thing that they definitely have demonstrated, is that Black women will not come back to, and this is why it's important for Black women to have affirming experiences in the healthcare system, because preventative care dictates that you have to keep coming back. And if
Right.
we alienate Black women from feeling unwelcome, from feeling dismissed and not heard in the healthcare system, then they're not going to come back and get that test. And that turns into the health disparity where Black women are having higher rates of cervical cancer and having higher rates of mortality and shorter survival rates.
Mm-hmm. Now you decided to do something about that and you started your own company. So let's talk about your company. It's called Our Culture Care. And tell us, I see you have earrings for your company, Our Culture
Yes, like
Care.
you
I
got
have my
yours.
Talking with Dr. Donna earrings. So we're repping our brand.
Yes,
So
yes.
tell me what is Our Culture Care and how, is it accessible to everyone or just certain people?
Good question. So, Culture Care is a telemedicine startup that is specifically connecting Black women with Black physicians. All the health disparities, like we even just talked about with cervical cancer, make Black women feel like they don't have a place to turn sometimes. And really, we kind of feel like if patients just had a Black doctor in their back pocket that they could ask questions, follow up on what their regular doctor said, a second opinion, that might make them more likely to follow up, make them more likely to get those screening tests, more likely to, find ways to also even cut costs, because sometimes, doctors do recommend expensive things that aren't necessarily necessary. So really for us, it's about having your back and having our communities back, because we can't keep relying on the healthcare system to mitigate health disparities. We feel like we're making our own Avengers force to do that for you. We pride ourselves on accessibility. Right now, we're only located in California, but in the coming months, that will change. Praise God. But
Right.
right now, if you are in the state of California, even if you're just here visiting, you can go to our website, ourculturecare.com, and connect with a Black doctor today, or email our concierge, which is concierge@ourculturecare.com, to set up an appointment based on your schedule and the physician's schedule. We have a few physicians currently. OBGYN, pediatrics, and urgent care are currently represented, and there are some more coming. So really, it's, do you have burning questions that you're not getting heard, outside of, the healthcare system? We are the cost of a copay. So it's $50 for 20 minutes, and you can prorate your time, because we want to make sure that you get access to the care that you need. And we don't want to have the typical barriers of, oh, you're out of network, or you're not in the same city as me. We don't, telemedicine is a way that we can, make Black doctors ubiquitous. And that is our goal and our vision.
That's awesome. And I'm so proud because I remember when it was just a thought, an idea, and a vision. And
Mm,
now here it is in fruition in California and growing to other states. So, congratulations
thank
to you, Dr.
you.
Cooper.
Thank
I'm
you.
going to give you the final word. What else? What would you like? What would you like people to know about cervical cancer, or just about general GYN health, that you want everybody to know? What is your
So
last
so
message?
one thing that I think a lot of people don't know, and it's changed radically how I practice medicine, when it comes to people who have abnormal pap smears or keep having HPV vaccines, excuse me, HPV show up on their pap smear, even if they have regular cells. There are ways to fix that now. So back in the day, I told you it was 9 to 26 is when you can get the HPV vaccine. They recently extended that to the age 45. So if you're up to age 45, you can still go out there and get the vaccine. But a new study showed that if you have abnormal pap smears, getting the HPV vaccine can actually help you clear that abnormal pap smear. And so that's a huge radical difference. And so that's another reason to not shy away from having an abnormal pap smear and know that there's another way, to fix that. So back in the day, we say like, oh, if you're a smoker, stop smoking. That's the only way we can fix your pap smear, essentially, despite just besides time. But now we have a way to really intervene, which is really exciting. So yeah, I'm like, that's my biggest excitement, honestly, because it really changed. I've been giving HPV vaccines to 60-year-olds and 47-year-olds. I'm like, and you can get it, and you can get it. And it shouldn't matter when you were born per se. Like this awesome
Right,
technology has come out. And yes, just like with the COVID vaccine, you should get the vaccine before you've been exposed. But
right.
with HPV, we're seeing that even after you've been exposed, even if you've been infected, this can actually help modify how it treats your cervix. And that is ingenious.
And that is life changing, for so many people. I think that's amazing. And I thank you so much for being my guest on this episode. My mission with this show is to end the cycle of premature death
Mm,
in the Black community.
yes.
We do that by focusing in on four pillars of health: our emotional and mental health, our spiritual health, our physical health, and environmental health. So thank you for coming on, because now you are a part of the Generational Health Network. So thank
Oh,
you.
thanks. Thank
Thank you
you.
so much. I wish you the best of luck with our culture care. We'll make sure to let everyone know how they can make an appointment if they're in the state of California. And we look forward to your expansion. So
Yes.
thank
And
you
if people
so
are
much.
not in California, our website is going to be updated so that you can just tell us what state we should come to next, just so that we can, poll and see who wants us.
Yes, I love it. I love it. Congratulations. And thank you so much again, Dr. Cooper. Really appreciate you being on
Thanks, Dr.
today's
Donna.
show. Thanks again to Dr. Cooper for such excellent information regarding cervical cancer. Such good information. We're going to move on to our food of the month. Our food of the month is black-eyed peas. Yummy. And we're doing that because black-eyed peas for the month of January, it's good for good luck and prosperity, but also because it is packed with vitamins. We've had lots of folks give us some tips on how they're eating their black-eyed peas this month. And so for tonight, we want to encourage you to try some Jamaican curried black-eyed peas. You see that picture? Doesn't it look yummy? It looks so yummy. We'll put also a link to the actual recipe and instructions so that you can go home and make it. Maybe not tonight because you just learned about it, but maybe you'll make it on another night. So again, thank you so much for tuning in to another episode of Talking with Dr. Donna. Again, our mission is to build a generational health network that will end the cycle of premature death in the Black community here in America and across the diaspora. Thanks again to Dr. Joy Cooper, who talked to us about cervical health. And again, if you are watching for the first time, or maybe you just haven't had time to do it yet, please go over to YouTube, subscribe to my channel, like my page, like the post, make comments, and make sure to share this show and this episode with someone you care about. Thanks again, and until next week, we'll see you. On Talking with Dr. Donna, we focus on four pillars of health to help build a generational health network to end the cycle of premature death in the Black community. I created Talking with Dr. Donna as a way to educate as many people as possible and give accurate information from a trusted physician. Go to Talking with Dr. Donna and get accurate information. And then share that information with your family and friends. And if you like what you see, Like my channel and subscribe. Remember, every Thursday, keep